RESA TV presents in 3, 2, 1, Dateline Schools with your host, Terry Harrington.
All this week on Dateline Schools, we're learning about autism as April is National Autism Awareness Month. And to provide some information, our special guests all this week on Dateline Schools are St. Clair County RESA intervention specialists, Natalie Adair and Rose Doré. And Rose, is this an issue that kids are born with, or is it something that they develop as they grow?
Well, they really do. They really are born with this, with autism, but sometimes it's not as apparent because some of the signs and symptoms that you would be seeing, they aren't quite as noticeable just to typical parents or even sometimes to doctors, although they're doing a better job of using like Natalie had said, the MChat. So. They are born with it. It just becomes more apparent as they get older, especially because of that, that it's a syndrome. And so some kids, sometimes they're even a little bit older when it's noticeably different in their social and communication.
And Natalie, is this something that a child can outgrow, or is it something that they're going to have for the rest of their life?
Autism is a lifelong developmental disability. They will not outgrow it. What we do know is that the earlier we intervene, the better outcomes and the better things we're seeing for kids as life continues to go on. We do know that early intervention is key and essential for these kids.
And with what you ladies have been describing all this week, it's got to be pretty difficult to determine whether a child is autistic. How do doctors determine that?
It is. There isn't a blood test that I can give that many people are looking for. It's definitely through trained observation. It's people who have been working in the field and knowing what are those signs and symptoms to look for. They really focus in on their social intent, their communicative intent, and then any behavioral distractions they may have or that may appear as an episode. And when they look at those three things, they have some checklists that can guide them and tell them to look in different areas. There are two main ones that many of our physicians use, which is an MChat, and then more trained, educated doctors in the area will use an ADOS for diagnosis.
And my guess is school personnel are trained too and help recognize some of the signs too, right?
Absolutely. The one thing you allude to, Terry, is that we have medical eligibility and we have school eligibility. Some of our kids have either or, and some of our kids receive services in both arenas.
More tomorrow. For Dateline Schools, I'm Terry Harrington.